You know that so-called done look? Now we're filming here in California, and we're known for
very common,
sometimes
correct,
Newport
yes.
Beach, that done look. I mean,
Yeah, we don't want to do that.
Okay.
Those are mistakes that were done in the past. The plastic surgeons nowadays should know better than creating those very hollowed out looks, those pull lifts, those extremely pulled faces. The approach should be subtle.
Okay.
And appropriate for the age.
All right, now we are just about out of time. You have a few more.
Yes.
Let's take a look.
The next lady also had blepharoplasty eyelid procedure done. Well, look at her eyes. Beautiful eyes, almond, but draped and covered by extra skin of the upper eyelids and bags under the eyes. So it gave her a very tired look. You can barely see the beautiful eyes, and that's what bothered her. So what I did for her was a little bit different. I did the same procedure for the upper eyes. Did not remove a whole lot of skin.
Big difference.
Very little. What I want to emphasize is that in her case, I did lower eyelid surgery, unlike the lady before, where I plumbed her up with the filler material. I did eyelid surgery, but instead of removing the fat from eyelids, which is easy, commonly done, and most of the time it results that a skeletal look that you're referring to, I draped the fat over the soft tissue of the mid-face.
So you used your own fat?
Her own fat to plumb up the eyes and efface those lines that are known as, that you commonly refer to as a tired look. Look at the eyes before. You can see the puffiness under the eyes. You can see the lines under the eyes, and the after, completely gone.
Even though it's subtle, it is
completely gone. Absolutely.
Big difference.
Big difference.
And these are young patients. So younger patients are going in and getting these procedures.
Well, she's about mid-40s, and this is an appropriate procedure for her.
Looks good.
The lady before was a little bit younger, so she didn't need that procedure. She needed something a little bit subtler. See the difference?
Yeah.
It's the duty of a good plastic surgeon to recognize what the patients are telling you and breaking that into many little problems and attack the problems appropriately for the patient.
Okay.
So that at the end, things are subtle. Same complaints, but different procedures were done.
So does as a surgeon, I mean, you're creating the beauty in this particular case. So your definition of beauty has to match theirs, or?
You have to listen to them. Even though they're saying the same things, I look tired, but that gets translated into different procedures for the same patient. You have to look at the skin texture, their habits. Are they sunbathing? Are they using skin products? What they're trying to achieve. Listen to the husbands sometimes. Look at the before pictures from way before, and formulate the plan that's appropriate for them.
Now, is it common people bring in their partners in on the consult? Do you like that or not like that?
Quite frequently they do, and actually I do like it because I would like to hear their story and what they have to say. And sometimes they're against it, but it's an art to be able to recognize to be able to recognize what the patients are saying, and at the same time convincing the significant other that they're in good hands, in safe hands, and she would like what.
Well, nobody wants their spouse to look different or pulled.
That's the complaint of most.
Is that the fear
of the husbands with the significant others, that they have heard on the news, they have read somewhere in newspaper or seen the pictures that facial procedures gone awry and it's hard to correct. So they're looking and convincing themselves that this is the plastic
surgeon. So find the right surgeon, though. I mean, you have to.
It's important.
Not only, I mean, you're biased. You feel board-certified plastic.
Yes.
But also look at their work.
Look at the work.
Is that your message?
And the pictures don't lie.
Okay.
You have to see the pictures log. Even sometimes I encourage them to talk to my previous patients and hear it from them firsthand. You know what their experience was.
I know you want to be positive. You said I don't want to say anything negative, but I mean, some guys have it and some guys don't.
That's
do you
correct.
believe that?
And as humble as I would like to be, yes, that's correct. Field of plastic surgery is not made to.
So be careful, because I mean, people live a long time today. You're going to be stuck with that face.
And for the most part, you want to get it right the first time. Obviously, it's harder to go back in and correct someone else's mistake, even though it's possible. But we would like to get it done the first time.
All right, and this is good stuff, by the way. We have time for one more photo.
And the last photo that I would like to show is pretty much the climax of all the procedures, and this is a lady who is somewhat older than the pictures that I've shown, and basically she has the complaints of all those ladies combined together. My neck, the folds around my mouth, my eyes, the bags under
Like mid-60s? How old is this person?
She's about mid-60, very pleasant lady. spends a lot of time in the sun. She has a horse ranch in Texas, and she's got a very aged look and very poor textured skin. A lot of lines around her eyes. So we pretty much had to take a different approach to her. Not only we are going to rejuvenate her and shift her, we're also going to make her look younger by resurfacing the skin. So we pretty much threw everything at her.
So this is a full facelift.
Correct.
Candidate.
And this lady brought a picture of herself 20 years ago, and obviously you can see a beautiful lady. And she had complete facial rejuvenation, meaning that not only the structures were changed, but the skin was resurfaced. And
so when we look at the after,
you can see how much younger she looks.
Huge difference.
The neck is much tighter, the jowls have gone, the corner of the mouth, the lines are gone. Under eyes, there are no lines or bags. Much, much younger, much happier looking.
I'd say 20 years younger. Right?
Easily, at least.
Is that what?
Yes.
I think anybody would see that.
Very happy, but she doesn't look artificial. She just looks younger.
Interesting. Artificial.
Yes. That's the term.
So a lot of people, I guess, are doing artificial facelifts.
If you're inexperienced, correct.
Okay.
You can overdo a part and not necessarily address another part, and the face becomes very disharmonious.
It's good stuff. I want to thank you for coming to the show. Final message.
I guess the message I'm trying to get out there is that if you're not happy with the way you look, there are procedures out there, but please make sure that you choose a plastic surgeon who's experienced in facial procedures, and not every procedure applies to everyone, meaning that sometimes surgery is a procedure, sometimes it's not. Facial fillers, Botox is the answer, and that will do it. The plastic surgeon you choose needs to have an artistic and a scientific view of the face.
Okay, I want to thank you so much for coming in. Very, very good stuff.
Thank you, Randy.
Great photos. And we'll have you back on the show to talk about some other procedures.
Look forward to it.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, or you would like to direct a friend to the interview, you can visit our website at wellnesshour.com. For now, I wish you good health.